What is monkeypox? Monkeypox is a disease caused by the monkeypox virus. It is a viral zoonotic disease, meaning that it can spread from animals to humans. It can also spread between people. What are the symptoms of monkeypox? Symptoms of monkeypox typically include fever, intense headache, muscle aches, back pain, low energy, swollen lymph nodes, and a skin rash or lesions. The rash usually begins within 1 to 3 days of the start of a fever. Lesions can be flat or slightly raised, filled with clear or yellowish fluid, and can then crust, dry up, and fall off. The number of lesions on one person can range from a few to several thousand. If you think you have symptoms that could be monkeypox, seek advice from your healthcare provider. Is there a treatment for monkeypox? Monkeypox symptoms often resolve on their own without the need for treatment. It is important to take care of the rash by letting it dry if possible or covering with a moist dressing to protect the area if needed. Avoid touching any sores in the mouth or eyes. Vaccinia immune globulin may be recommended for severe cases. An antiviral that was developed to treat smallpox was also approved for the treatment of monkeypox in January 2022. Can people die from monkeypox? In most cases, the symptoms of monkeypox go away on their own within a few weeks. But in some individuals, they can lead to medical complications and even death. Newborns, children, and people with underlying immune deficiencies may be at risk of more serious symptoms and death from monkeypox. Complications from severe cases of monkeypox include skin infections, pneumonia, confusion, and eye infections, which can lead to loss of vision. Around 3% to 6% of reported cases have led to death in endemic countries in recent times, often in children or persons who may have other health conditions. How does monkeypox spread from person to person? People with monkeypox are infectious while they have symptoms. You can catch monkeypox through close physical contact with someone who has symptoms. The rash, bodily fluids, and scabs are particularly infectious. Clothing, bedding, towels, or objects like eating utensils, dishes that have been contaminated with the virus from contact with an infected person can also infect others. Ulcers, lesions, or sores in the mouth can also be infectious, meaning the virus can spread through saliva. People who closely interact with someone who is infectious, including health workers, household members, and sexual partners, are therefore at greater risk for infection. The virus can also spread from someone who is pregnant to the fetus from the placenta, or from an infected parent to child during or after birth through skin-to-skin contact. It is not clear whether people who do not have symptoms can spread the disease. Thanks for watching. Like, share, subscribe. White Lane Healthcare.